So we're going to move forward, and I'm going to start with Dita. We have two wonderful, beautiful, unique women here today who are going to share their stories. And I thought this was kind of a great way to kind of bring our program to the end in some ways. But without further ado, Dita.
Well, thank you, first of all, Erin, for your program and for inviting me in this call. I'm happy to share my story, and I'm happy that I get to brag about the professional teams that I had and the professional in general. There was many reasons why my recovery was so successful. As a matter of fact, in my book, I say I don't believe that I'm a survivor because I never exercised the thought that I would not survive. And one of the reasons for that is I had full, absolutely confident in my doctors, my nurses, and their treatment of it was really, really vital to why I was really advanced from when I was diagnosed till I had my first chemo. It was 3 weeks, and they had an option of pushing me further out, and it was like, no, it was moving. I could see it. And so in some ways, my journey, I did not have a lot of time to have second opinions had I thought that was necessary. I didn't have time to have a lot of opinions about anything or do any research. And in many ways, for me, that was a blessing. It's in my book. So that was one part but I really appreciated my medical team, my surgeon in particular. She wrote a lot about in her materials was attitude. And for some reason, when I got my diagnosed, I was filled with gratitude. And it was just gratitude that I was medical capable hands, that the research has gone so far. And I really, and I still am very protective of that feeling because I feel like carried, but it was also nice to have a doctor that was open to, my own participation in this as a patient. It empowered me, I felt, but it was also, she was open to, there were sometimes things in between the lines, and it gave me permission to participate in my own healing, which I ran with. So that was one part. And then the other part, why I heal so bad, is what we've already touched upon. Heal so great and so fast was what we already touched upon, and that is Erin's program. Again, my mom, when she was done, it was like, and I think a lot of us go through that. It's like we're at the end of a cliff. It's like, now what? Who's going to keep an eye on us? And then, having the PALS program to rely on, and it's not just here and there, it's 12 weeks, but not only that, there is another 12 weeks after that if you want that. And then after that, there was 2 years that you could participate in, and that is so comforting to know. And along my entire time, I just felt this universal support for breast cancer survivors and patients, and I really, really felt that. And why Erin put this program together, I'm still baffled of the kindness and the big-heartedness and the thoughtfulness for it. And I'm so lucky that I had the opportunity, and I was within distance where I could participate. And I totally encourage Georgia, you to go forward with it. If I could just begin to tell you the impact you will have in people's lives, I think that will carry you through. And I really sincerely believe that there are grants out there that might be able, just like Erin, that could help possibly kick off your program. But I totally encourage you to go forward with it because it's amazing. The program is wonderful. And the comfort of knowing that you were not alone when the treatment stopped was really great. But it was also the participation, the humor, the lightheartedness, the fact that you were among people that are going through or have been through or just coming into what you were going through is really good. It's a very unique time of life, and in its own weird way, it has so many blessings. And so that was this. And then the third part was also very healing with my book. And one of the big issues in my book is that I love my doctors, I love my nurses, even the cashiers at Dartmouth was super sensitive. I totally appreciate Erin, all she did, and Dr. Leila, who was the nutritional part of this program, but it was also the other women in the waiting rooms, you know, telling their stories, helping me, making my life-saving decisions. And that was the cause of my book. I wanted to be that voice. I wanted to be very light read on a very hard subject, because I had chemo, I had the operations, I had, you know, radiation, I had all of it. I'm still on tamoxifen today for another 6 years. But it was their stories that really, really helped me. And I wanted to be that voice. I wanted to familiarize another woman with the terms prior to going into an appointment, and just demystify the whole process, because we have so much hope and there are so many reasons to be positive, even if you do get this hard diagnosis. And so I am definitely recovering, and I give thanks to Erin every day. My book will come out in hardcover this spring. I have just got a publisher, so that's really exciting. And so that's my story. I am healing. I am feeling great. And in many ways, that is absolutely thanks to Erin, because the program, first time, the PALS, I was still in treatment. I could only do half. But the Bridge program, I really rebuilt my strength. I rebuilt life, and I rebuilt hope among the whole thing. So thanks to Erin and Georgia, go for it.
Thanks, Dita. We also have Erica, who's going to share a little bit about her story today. So I'll let you.
Thanks, Erin. You found a picture. I was thinking, wow, I'm not prepared like Dita was. I'm going to share a phrase to start off with, Liz, that I just heard the other day, which I like a lot better than the new normal, and it's applicable here, which is the new possible. And just because sometimes the possible is actually, you can find yourself in a better place than you were before. So that allows you to kind of go down that road. My story is, I was diagnosed while I was living in Cambodia, and so that meant there wasn't any treatment available, or very, very, very limited treatment available within Cambodia, and so I had to travel to Singapore for my treatment, and the care was wonderful, absolutely incredible. I can't say enough about the professionalism and just how confident I was, not unlike Dita, with people that I worked with in Singapore. It was under the UK and Australian protocol, so it was a little bit different protocol-wise than what people were doing here in the US. But when I was, and my intervention was just surgical. I had surgery, and then I went back to Cambodia. And in Cambodia, and like many other developing countries, cancer is not something that you talk about, because it's pretty much a death sentence for most of the people in the country. If you get a cancer diagnosis, there is very limited treatment available, and that's only available to people with resources, and oftentimes it's not within the country. So it's just not something that you talk about. So even though I had very good, very good prognosis, and going forward I was healthy and doing well, there wasn't anyone to talk about it with, because it just wasn't a part of the discussion you could have with anyone except for other expats. So that made it a little bit challenging to kind of come to grips with yourself when there's, your friends, your close friends kind of get sick of talking about it with you. But the harder thing was that, like everyone, Liz and Bridget, or sorry, I see your name here, Dita, said, there wasn't any idea of follow-up. I mean, when my surgery was over and I was getting ready to head home, they gave me a sanitary pad to tape to my chest. So it was, there just wasn't a lot of support about like, oh, so what's going to happen next with you? And I made the probably unfortunate decision. We were trying to decide whether or not to move back to the US and when. And so decided that, after this, I was in between contracts with my work. It made sense to come back to the U.S. at that point. Probably after living overseas for a decade, moving back to the United States of America 6 months after you've had a cancer diagnosis and surgery probably wasn't the best time to be doing it from a psychological perspective, because I had developed a support network with my my primary care doctor in Cambodia, who was an NHS doctor from the UK, who was fabulous, and a counselor that I eventually found, and my expat network of friends that kind of become your family in those situations. But I came back to the United States, and I didn't have a medical community here because I had not been treated here. And it proved very difficult to actually figure out and find the people who would support me from a medical perspective. I had my doctor in Singapore write up my case so that I know exactly who I should be talking to and what I should be telling them. And that began kind of a several years long battle that was resolved. I'd be happy to say, I wish you were on the call, by Mary Chamberlain. I somehow found my way to her door, and she sat me down and said, okay, I understand your story. What can I do to help you feel better 5 years later? And I said, I just need to know if I'm doing everything I'm supposed to be doing, because nobody's been talking to me for the last 5 years about this. So that's a shout out for Dr. Chamberlain at DH. So some of the ideas that kind of came from my experience of then finding Erin 5 years after I had surgery and come back to the US. I was still traveling. This is a picture of me on the Indus River in northern Pakistan, because I did a lot of work in Pakistan. And one of the big things is that having a program like this, like the PALS program, located outside of a healthcare facility was key for me, because I wasn't a part of the healthcare kind of system, not having had a treatment team here, though it sounds like that didn't really make a difference from the stories that I've heard today. But having it available through UVAC made it much more accessible. I actually knew about it and could find it and call Erin and say, okay, tell me about this program, what can I do? So that was one thing that I think is important to think about, is just how it's going to be accessible to people that aren't currently in treatment at your facility, depending on where you think about housing a program like this. Another part is the focus on wellness as opposed to health, because it's a lot more comprehensive and a more holistic look at it, and it kind of takes into account the social side and the emotional side, in addition to the physical side. It's not that the physical wellness isn't a part of it, it's just that it's a little bit more expansive in my way of thinking. And so that's one of the things that I found really particularly engaging about the PALS and the Bridge and the Living Beyond, is just how it hits all of those high points with the nutrition piece and the lymphedema piece, the exercise, the socialization. It just has a little bit of everything. It really focuses on the wellness of your whole person. Additionally, it was a platform for some of the informal discussions that probably I would have had with people sooner after my whole experience if I'd been in a context where that was something that you talked about. That has proven just priceless. And you realize you can gain a lot of strength from each other. And it's not, I was a little bit worried about coming into a program where people would be at different stages of the process. And I learned very quickly that you can gain a lot of strength from people who are in different stages of the process, even if they're in the final stages of the process of dying. And that was actually really kind of inspirational for me. I felt like that was a gift that these people were giving me as they were figuring out how they were exiting the world. A big one is just having expert guidance on what motion was supposed to feel like, what discomfort was to be expected from not having exercised for a few years. I mean, I got to the point where the way I was using my upper body it felt different, and I didn't have a way of determining whether that difference was healthy and part of the re-engagement cycle, or was I hurting myself? And so having Erin's expertise and the other people that she brought in to talk to us was really helpful in kind of providing a framework for, yeah, that's going to hurt because you haven't been using those muscles for a really long time. That's okay. Or no, that should not be feeling that way. Let's find a workaround. That was a big part of it. And then another one was permission to start from an easy, and I put that in quotations because it's not necessarily easy, but an easy baseline. You're not starting from where you stopped. You can't start where you left off before this whole process happened. And a lot of times our personal expectations, that's where we want to start. So this program actually, because of the way it's based and the data and evidence it's based on, has you starting at a very accessible baseline. And that can be kind of liberating from your own expectations that you might have for yourself that might be difficult to otherwise free yourself from, and kind of give yourself a do-over. So yeah, overall, the 2 years that I've been involved with the program, it gave me the strength to go back and fight the battle at DH and say, no, I need somebody to talk to me about what happened to me 5 years ago and what I'm doing today and whether I'm doing what I'm supposed to be doing. And that's when I found Mary Chamberlain. So, but the strength that I had to do that came from the group of people that I was working out with. And that was maybe 4 weeks after the program started. So it can be a pretty instantaneous sort of support network. The comfort with your own body, it's changed, and you're working out with everybody else who's also facing the changes in their body. And that is, you're not working out with the 26-year-old who hasn't had any of the experiences yet necessarily. I'm generalizing here, not to say that there aren't 26-year-olds who've had these life-changing experiences, but generally when you're in the gym, that's the assumption you make when you see all of these other young people just whipping through all of these routines. And you realize, no, that's not me. And I'm with a group of supportive people who are also trying to get back to a comfort zone. And that was really helpful. So that's kind of my story. Where I am today is much, much better frame of mind, much, much better physical condition. I mean, all of my PALS exercises kept me going through COVID, even got my husband doing, and every morning we got up and did at least a couple of exercises with laps around the house thrown in for good measure. And I was not a regular exerciser before I started with PALS. So that was a big one. And one of the things that I took away was that my sense of gratitude at the fact that I had all of these opportunities available to me. And I'm now actually working. I have met another survivor who was also treated in Singapore and lived in Cambodia, a Canadian woman. And she started fundraising almost 10 years ago to build a women's cancer hospital in Phnom Penh. And so I jumped on board with them to help them make that a reality. And the hospital opened at the beginning of last year. So the experience is life-changing and life-altering, and with programs like the PALS program, it can also leave you in a better place, which is hard to believe than you could ever imagine. So that's my story.